Hi, Katie.
Hi.
I'm Dr. Mad.
Hi.
So I read in your file that you were having a lot of back pain.
Yes, so I was visiting my cousin in Vermont last week and I slept on her couch.
Okay.
Because that's all the room she had, and my back has been hurting so much ever since, especially the upper back on the right side.
Upper back on the right side.
Mm-hmm.
Okay. And what sleeping position do you usually have?
I usually sleep on my side. Yeah.
Did you sleep on the right side? Do you think that may have caused it?
I did, but I really do think it was the couch. It was super uncomfortable. I tossed and turned a lot. I tend to do that at night anyway. So.
Do you sleep on your belly sometimes?
Actually, no, I never sleep on my belly.
Okay.
Yeah.
All right. Do you remember having any accidents before the pain started?
No, we did some hiking, but I don't remember pulling anything there.
Okay. Did you fall while hiking?
I don't remember falling. I just remember waking up from the couch and it just being super painful. Like on the second night was when it really started to hurt.
Okay. And have you ever had this type of pain before?
No.
Never.
No. Yeah.
Okay. Any back problems that I should be aware of?
No, I mean, I hurt my sciatic nerve in high school when I was running long distance, and that still kind of lingers, even though it's been 15 years. It still sometimes flares up, but that's pretty much it. Other than that, it's healthy.
Okay. Is it on the right side or left side?
That's on the left side.
On the left side.
Mm-hmm.
Okay. And all right, well, what I'm gonna do is I'll have you stand up. I'll have you take a few steps. We're going to look at your gait, how you push down with your heel. Sometimes the back problems can be caused by a problem with pronation of the foot, and if you have a flat foot, that could also be the cause. So let's go ahead and see what we can do for you today.
Okay.
All right, Katie, just take a few steps. I want to see how you balance yourself. Move forward. Go ahead. Keep on walking. Go ahead and turn around. I'll have you keep on walking until I tell you to stop. I didn't tell you to stop, so just keep walking. All right, perfect. And now I'm going to have you turn around. Come towards me again. One more time. I'm taking a look at feet, knees. Keep on walking towards me. I'll have you turn around. All right, and now just walk normally like I'm not even here and you want to go that way. Okay, and now one more time, come back towards me. Okay, and turn around, and one last time. All right, I'm gonna have you stop right there. Okay. Let's see what we have here. Looking at neck and shoulder angles. Okay, I know you did say that you're having some pain on the right side, but I'm seeing some asymmetry on the left side as well. So we're gonna check your mobility. Okay, go ahead and turn your head towards your left side. Good.
That's actually painful.
This one.
Yeah.
Turn your head towards the right side. Okay. Now try to touch your chin with your chest. Okay. Very little spine mobility. We're gonna work on decreasing some of that inflammation in this area. Go ahead and come back to center. I'm gonna have you touch your shoulder with your left ear on this side. Okay, try not to move your shoulder, so just try to touch as much as you can.
I can't do that.
Okay. And come back to center. And we'll do the same thing on the right side. Okay. And center. Okay. Now what I'm going to have you do, relax this arm. I'm going to guide you to touch the middle of your back, right in between your shoulder blades. So try to do that without me touching you. Okay. All right, let's go ahead and come back to center. This side is a little bit inflamed, feeling some knots right under the scapula, which really doesn't allow you for a lot of movement, and that is what is causing some of that strain and excessive pulling on the left side. All right, let's go ahead and check your right side now. So we'll do the same thing. Okay. All right, go ahead and come back to center. Okay, not as bad on the right side as compared with the left. But as we're moving down on the medial side of the scapula, there is some tension here that we can definitely go ahead and work on today. Right, what I'm going to have you do is I'll have you lean forward and try to touch your knees with your hands. Okay. Okay, no signs of scoliosis or lordosis. All right, come back to center. And now we're going to check your hips as well. Go ahead and try to sit straight. Okay, have your heels kind of close together. All right, perfect. Okay. All right, so for this part, what I'm going to have you do is I'll have you lift one knee up.
Okay.
Okay, so let's start with the left. All right, 90 degrees with the hips. All right, go ahead and push it back down. Okay. And we'll do the same thing on the right side slowly. Put your knee up 90 degrees with your hip. Good. And push it back down. All right, no clicking or popping on that side. We're going to check hips alignment. Okay, S2 and S3, we're going to have to make sure that we do shift them a little bit. Make sure that we allow some nutrition to go in. This will also help with the digestive issues and reproductive organs to increase some of that circulation and bring blood flow to those areas. Okay, I'm gonna have you sit on the table and we're gonna start with the scalp, moving down all the way to the hips and toes. Okay, for this part, I do like to put some gloves on. We are going to apply some anti-inflammatory oil on the scalp area, and we're going to really work these muscles right here. All right, so what I'm gonna have you do is I'll have you lean forward just like that. Perfect. So I'm going to remove the hair tie and kind of bring your hair forward. Okay, so we're going to work on this side right here.
Okay.
And we're gonna have to massage it really good. So we really want to break this fibrous tissue right here. Are you having a lot of pain in this position?
No.
Let me know if it hurts, okay?
Feels good.
Okay, it's gonna feel a little bit cold. Are you comfortable?
Yes.
Sure.
Yes, I really am.
Okay.
Yeah, this feels really good.
Okay.
My head's resting on my knees.
Okay. Okay, all of the redness that you're gonna see, it's normal. We're going to apply some pressure therapy and really moving up the scalp, applying some gentle pressure. And some of the points that we can trigger an anti-inflammatory response. Okay, so I'm gonna have you put your arms around you. Okay, perfect. And is it okay if I kind of play with the shirt so that I can have access to the back? Alright, so I'm gonna go ahead and do this side first and then the right side.
Sounds good.
I'm going to use cupping therapy to stimulate blood flow to the area. before we do any kind of neck and spine adjustment. Okay, we're gonna work on the shoulders. Let's apply a little bit more oil. Does it hurt?
No. But if you could get like right here in this area, that'd be amazing.
Okay. Okay, we're going to check your chest now, so your upper back. All right. Let's see. I'm gonna have you take a deep breath in and breathe out. Good. All right. Let's go ahead and lift legs up like this, 90 degrees. And on the count of 3, I'm gonna have you hold your breath. Okay, 1, 2, 3. Hold your breath. Let's do that one more time.
Okay.
So take a deep breath in and hold it. Okay, very good. Breathe out. Okay, I'm gonna have you flip on your back now. And we're gonna do a neck adjustment. So first I'm going to use a little bit of traction. Just stretch the neck muscles. Okay. I'm gonna have you take a deep breath in, okay? And breathe out. Good. And again, take a deep breath in and breathe out. Good. Let's go and take a look at your arms. Let's see, where's the mic? Oh, Jesus. Going crazy.
Still would have been okay.
All right. Okay, let's go ahead and adjust your arm here. Breathe in, breathe out. Good. Okay. All right. Breathe in, breathe out. Good. Okay. Go ahead and uncross your legs. So I'm gonna have you turn on your left hip. Okay, and give yourself a hug. Good. I'm gonna have you stretch this leg. All right, count of 3. Go ahead and take a deep breath in. Breathe out. Good. And we'll do the same thing on the other side. Slowly. Okay, breathe in, breathe out. Perfect. All right, let's take a look at your legs alignment. Let's go ahead and stretch this leg. 1, 2, 3. Make them equal. 1, 2, 3. All right. Okay, perfect. All right, I'm gonna have you sit back up, stand, and let's take a look at your shoulders.
Okay.
Okay, I can definitely see a better alignment on the left side, and you're automatically going to feel a lot of less pressure and pain that is coming from the right side. Spine looks good. We were able to really work on the muscles that are attached to the occipital and the cervical bones. So we worked on Atlas, C1, Axis, C2, and moving down to the thoracic, we're able to crack some of these bones and really move them, shift them to the side. We can't shift them too much all at once. We have to keep on doing this. So we're gonna have to see you about 3 times a week for the first month or so, okay? Until we are able to put everything together. All right.